This study was published, first of all, early in this year, and it addresses the key drivers of fertility levels and differentials in India at the national, state, and population subgroup levels. So as you know, improving sexual and reproductive health has been a focus of government policies and programs for decades. And it is against this backdrop that our study was designed to spotlight the key factors determining average family size in India. We used data from the National Family Health Survey, the one that was conducted in 2015 to 16, combined it with data from a national study of abortion conducted in 2015. This is a strength of the study, that data on abortion were available for the same time period as the NFHS. So we analyzed these data to estimate the contribution of each of the 4 key determinants of average family size, which are women's age at marriage, contraception, abortion, and postpartum behaviors. The analysis provided estimates of the impact of these 4 determinants for key demographic and socioeconomic subgroups. Those were age, place of residence, education, wealth status, household wealth status, and caste. And these estimates are for the national level and for each of the 29 states. We used a well-known demographic model, adapted it to the Indian context, and built on recent work by other researchers such as Jayachandran and Stover. These 4 key factors explain why family size today is much lower than the biological maximum, which is typically 10 or more children per woman, and also much lower than it was in India decades ago, where it was a little over 6 children per woman. So our key findings are that marriage is the most important determinant of the reduction in fertility from the biological maximum, contributing 36% of the reduction, followed by contraception and abortion, contributing 24% and 23% respectively, and postpartum behaviors contributing the remaining 16%. The national pattern of contributions is found in most states and subgroups. However, findings suggest that a few factors were more important than average for certain areas or groups. For example, abortion makes a larger contribution than contraception among young women and better educated women. And we'll talk more about that later on. But overall, the absence of generalized differences between states and across socioeconomic groups in the role of these 4 key determinants suggests that as family size declined, fertility management has become increasingly homogeneous. These findings support other research documenting the barriers that women in India face in obtaining good quality contraceptive services. The finding that abortion is an important method that women and couples use to achieve their family size goals underscores the need for improved access to safe abortion care and adequate information on use of medication abortion.